Has now well and truly become the worst hit city in the country in terms of the number of COVID cases. With over 70,000 cases, Delhi has surpassed Mumbai by far. To tackle the growing concerns, the Delhi government has now prepared a 8-point strategy, which is a revised COVID response plan in line with recommendations of Dr. V.K. Paul committee. The plan includes conducting Sero-Survey, that's a serological survey of 20,000 people across districts, and also house-to-house screening by the 6th of July, among the other measures. In fact, door-to-door surveillance by health official is one of the important pointers in this 8-point strategy that has been initiated. This is being done to collect data of people vulnerable to the COVID threat. Ayushman, in fact, took stock of the old Chandrawal area of Majnu Ka Tila in Delhi, where door-to-door screening process and surveillance process is currently underway. Ayushman is joining me live now. So Ayushman, 2 or 3 points that we are looking at in terms of the new strategy. First, of course, the antigen test, which you already spoke about, but now this aggressive screening process through door-to-door surveillance and the new methods that have been introduced to identify the vulnerable patients. Take us through the details, please.
Chandrawal area of the national capital. This is the Majnu Ka Tila. The congested bylanes are there. You can clearly see it. And what is the point of doing the door-to-door surveillance? You can see here two people. One is the ASHA worker and other is a nurse which is currently talking and taking those details. You can see that mobile which is being used as an Assess Corona app in which the data is uploaded. Now the key focus here remains, Afrida, because it is not a containment zone. It's a normal door-to-door screening. This is focused that people who are having comorbid condition, people who are elderly, and people who are having influenza-like or SARI infections like symptoms, their details are taken by these nurse and ASHA workers. This detail is collated by evening, and the CDMO, the Chief District Medical Officers, in the evening go through that data, after which they will be taking a decision as to which are the areas in these bylanes. Because if you see, these are very congested bylanes, and in these bylanes, the officials visit, and after visiting, they make an assessment of the situation. How many people are there who have got the symptoms of COVID, and elderly people are there. Based on that assessment, the rapid antigen kit deployment in these areas will take place. The officials will come and the testing will begin. This is the plan on paper. Now what is happening? The officials are being told that they are getting the data, and all these data gets collated, and the officials are not just the ASHA and ANM workers, but also the SDM. SDM accompanies them so that proper data entry is made, so that a proper surveillance in this area can be done. Now I am also seeing the SDM here. We'll try and speak to him. Yes. Afrida, सर यहाँ पे जो अभी डोर टू डोर सर्विलेंस आप लोग कर रहे हैं, इसका बेसिक फोकस आइडेंटिफाई करना है कोमॉर्बिड और इन्फ्लुएंजा लाइक सिम्टम के पेशेंट्स को.
उसका एक आइडिया ये भी है कि जो हमारे जो वृद्ध लोग हैं, जो सीनियर सिटीजन हैं, जो 60+ एज कैटेगरी के लोग हैं, उनको भी टारगेट करना इस सर्वे का एक जो है बेसिस वो है.
ये कंटेनमेंट जोन तो नहीं है, तो यहाँ पर फोकस क्या रहता है? और इस डेटा जिसको आप लोग कोलेक्ट कर रहे हैं, ये डेटा शाम में आप लोग क्या करते हैं?
जी, इस डेटा को हम लोग असेस करते हैं शाम को. जो इस इलाके की मेडिकल ऑफिसर हैं, मेडिकल इंचार्ज हैं, वो इसको असेस करती हैं कि जो ऐसे सिम्टम्स वाले लोग हैं या जो 60+ वाले हैं, उनको डेली बेसिस पे असेस करा जाएगा टीम के द्वारा. अगर किसी को सिम्टम्स हैं और अगर वो होम आइसोलेशन के लिए उसकी जगह है, तो वो होम क्वारंटीन हो सकते हैं या होम आइसोलेट हो सकते हैं. क्वारंटीन तो नहीं मैं बोलूँगा, होम आइसोलेट हो सकते हैं. अगर होम आइसोलेशन की जगह नहीं है और उसमें सिम्टम्स हैं, तो उसका टेस्ट किया जाएगा, और टेस्ट के बाद अगर वो पॉजिटिव आते हैं तो तुरंत उनको कोविड केयर सेंटर ले जाया जाएगा, जहाँ पे उनका ट्रीटमेंट करा जा सके.
अभी तक ऐसी कितनी टीमें आप सर, चूँकि मजनू का टीला एरिया देख रहे हैं, बहुत कंजेस्टेड इलाका है सर, ये कितनी टीमें आपने बनाई?
ये जो इस समय हम यहाँ खड़े ओल्ड चंद्रावल में, यहाँ पे लगभग हमारे मुताबिक 2500 से 2700 की पॉपुलेशन है. और इसमें हमारी 5 टीमें ऑलरेडी काम कर रही हैं. हम शाम को असेस कर लेंगे. अगर हमें ज़रूरत पड़ेगी तो कल हम इसको डबल कर देंगे, क्योंकि ये टीमें कल ही बनाई गई हैं. और मैं अगर अपनी सब डिवीज़न की बात करूं तो मेरी सब डिवीज़न में बुराड़ी में, तिमारपुर में, वजीराबाद में
कंजेस्टेड लेन्स हैं वहाँ पर फोकस है सर।
नहीं, सर्वे हर जगह हो रहा है, चाहे हम रूपनगर, शक्तिनगर, कमला नगर की बात करें, क्योंकि वो भी सब डिवीजन सिविल लाइन में पड़ते हैं। सर्वे हर जगह शुरू हो चुका है। जो वहाँ के मेडिकल ऑफिसर इंचार्ज हैं, जैसे शक्तिनगर के डॉक्टर सोनिया हैं, कमला नगर के डॉक्टर उर्वशी हैं, उनके तहत ये सारा सर्वे शुरू हो चुका है। बस फर्क ये है कि पहले केवल कंटेनमेंट जोन में ये सर्वे हो रहा था, अब पूरी दिल्ली में इररेस्पेक्टिव ऑफ कंटेनमेंट जोन ये सर्वे हो रहा है।
So there you can see, Afrida, the register where the details are being noted by the ASHA worker, and the corona application where the data is being feeded. This is all being done to identify the comorbid people, the senior citizens, and also people with influenza-like illness, so that testing facilities can be made available in these bylanes.
Absolutely. This is a highly intensive, intrusive process that is being undertaken. What is the larger idea, Ayushman? Because this, let's not forget, is part of the new COVID strategy. There is also something called the Sero-Survey, the serological survey that the government plans to bring in. Under the circumstances with Delhi now hitting very high numbers, what exactly is this going to work towards in terms of helping the cause of fighting the virus?
Well, Afrida, the Sero-Survey is basically to give an idea of the prevalence of COVID infection in the areas where the infection rate has spread. Now, if you talk about the Sero-Survey, it will be very important to assess, because Delhi has got a population of at around 1.8 crore people. And if you have to identify the prevalence, there are only 20,000 samples which can be taken. So this door-to-door survey will also give a brief idea to the officials as to what is the status in the non-containment zones. Because we have seen after the DDMS meeting, the focus has been somewhere on the containment zones. There is a delineation taking place. There is a continuous surveillance taking place. But what is happening in the other zones? Now, for that reason only, these small team of 3 people have been made under the SDM. And these SDMs have been told that they will be monitoring the work style. They will be going through with these people to know as to what is happening in these non-containment zones, so as to assess the situation on ground.